Hi, my name is Shelby Wagers, and I'm going to be demonstrating how to change linens in an occupied bed, as well as how to properly treat soiled linens. So the first thing we want to do is introduce ourselves to our patient, perform proper hand hygiene, confirm our patient's identity by asking them for 2 identifiers, and then we would put on sterile gloves. And so we would come here and make sure our bed is at waist level for proper body mechanics, and then we would want to lower our patient's head in a supine position. And then we would go ahead and lower the spray. And so to start off with, we would untuck our comforter and our sheets from the bottom. And then we're going to go ahead and take our comforter off. And if this was dirty, we would be sure to keep this away from our body when transporting it to a laundry basket. But since it's clean, we're just going to put it on the chair here. And then next, we're going to give our patient a bath blanket to ensure their privacy. And if they were able to, they would go ahead and hold that for us. And again, if this was soiled, we would keep it away from our body and make sure we aren't putting any fluids or anything like that onto the floor. And we would also go ahead and put this in a laundry basket. Next, we would ask that the patient grasp the side of the bed here. And we would adjust the pillow. And then we're going to go ahead and roll this toward our patient. And we want to make sure that our access here is rolled toward the patient. And if we had a protective pad, we would go ahead and lay that here as well. We would also want to make sure that we lift this handrail. Okay. And again, we would lower this side, and our patient would turn and grasp the other side. And they would have a bath blanket to ensure their privacy. So then we're going to remove our bottom sheet and place in the linen basket. And we would want to make sure our pillow was adjusted for our patient's comfort. And then here we would also make sure that there were no wrinkles and that our protective layer was positioned properly. And then our patient would turn back over. And with their bath blanket still draped, we would go ahead and take our second sheet. And they would grasp this for us while we removed the bath blanket from underneath. And again, we want to ensure that there's no wrinkles. Okay, and then to tuck, we would go ahead and lift the bottom and the bottom sheet, or the top sheet and the comforter, and then we would go ahead and tuck our access. Holding this at an angle. And then letting it drop. Same thing with this side. So holding our excess at an angle and then and again, with dirty linens, we would want to make sure that we put those into the waste bin as soon as possible and make sure that we're not shaking anything out onto the floor. And in order to do our pillowcases, we would try and keep it away from our body. Take this off, it would go into the linen basket. This would be inside out. So we would want to then grasp our pillow. And then we would take off our sterile gloves and perform hand hygiene, and that is how you change an occupied bed.